We're going to talk about our respiratory defense mechanisms. We filter air, so we have little nose hairs that when we breathe in, they're kind of our filter. They're finger-like projections that are filtering junk that's coming in our nose to prevent it from going down into our respiratory system. We have cilia, which covers the airways from the level of the trachea to the respiratory bronchioles. This moves the mucus towards our mouth. The ciliary is also impaired if there's dehydration, if patients smoke, or if they had inhalation of high oxygen concentrations. Infection, ingestion of drugs, and the drugs they include in this category are atropamine, and any kind of anesthetics, alcohol, and also cocaine. The other thing I just want to note is with respiratory patients, they usually have chronic lower respiratory tract infections because their cilia are actually destroyed during these infections, so they just keep getting it over and over and over again. We also have the reflex of bronchoconstriction. This happens when inhalation of large amount of irritating substances, and this would be an example would be dust, come in, they constrict the bronchi. The bronchi constrict in order to prevent those irritants from going in. So if you have someone who has hyperactive airways, and this would be someone who has asthma, they may have bronchoconstrictions after something possibly triggered it. A lot of times with asthmatic patients, perfumes, if someone has a lot of perfume on, that will stimulate an asthma attack, which is hyperactive airway, and then they end up in a bronchoconstriction. And that's something we definitely don't want. So we're going to talk just a little bit about subjective data. One of the things before I start on to subjective data, you always have gerontological assessment differences. These are what are actually expected or normal in the elderly population, and that is on page 481, table 26-4. So the next thing we're going to talk about is some subjective data. You guys know you have a health history box in every assessment chapter. This one is page 483, table 26-5. This gives you an example of questions that you would ask that would be specific to the respiratory system. A few things that we would want to ask someone who comes in and we're looking focused respiratory subjective data. Do they take bronchodilators? Are they on an ACE inhibitor? Why would we want to know if they take an ACE inhibitor? We know and talked about in cardiac, one of the common symptoms of an ACE inhibitor is a dry, hacky cough. So that's normal. We would need to know if the dry, hacky cough is because of the ACE or is it because of something else. We would also want to know if this patient takes oxygen at home. How often do they use it? Is it continuous? Do they just use it as they need it? Do they have to use it when they're up moving around, when they're out and about? Those types of questions. We'd also want to ask any kind of surgical information. What are their response to any kind of treatments? This may be a patient who has COPD and they frequently come in because they have lower respiratory infections and have to get something called a nebulizer treatment to help open up those alveoli and help them breathe. So we would need to know their response to that. The other thing we want to know is shortness of breath. Are they having any dyspnea? When do they have it? Do they have it at night? Do they have it when they're moving? Do they have it when they're sitting? Those types of questions. And we do want to know about cough. When we talk about a cough, you have to dive into it. Is it productive? If it's productive, you're going to have to get all up in their business and ask them what color it is. Is it thick? Is it green? Is it yellow? Is it watery? What does it look like? Is it non-productive? And the other thing we would want to know is if they've had hemoptysis. Hemoptysis is blood. And we would typically see hemoptysis in patients who have TB, pneumonia possibly, lung cancer, are a couple of where you would actually see hemoptysis. So this is your bloody sputum. So we're going to move on to objective data. So this is going to be the physical exam part. We're just starting head to toe. If you always think starting head to toe when you're doing your assessment, it always works in a better sequence. Doesn't mean it always goes that way, but in the perfect world, we start head to toe. So we would inspect the nose. We're looking to see if the nose is patent, is there any inflammation, deformities, symmetry, any discharge. One of the things that you would do in order to check for patency is occlude one nares and check for breathing, and then occlude the other nares and check for breathing. And when I'm saying check for breathing, you usually see flaring of the nair that's not occluded. They also do this on newborns when they are born. The other thing we want to do is inspect the inside of the nose. The mucous membrane should be pink and moist. We want to also look at the turbinates. We want to see if they're inflamed. We would also want to assess for any kind of discharge, color, and consistency, because depending if they're inflamed, it's possible they have allergies. We have patients who come in, people get seasonal allergies. The other thing you're going to do is inspect the mouth. You're going to look at color, lesions, masses, gum retraction, any bleeding, or any pore dentation. Inspect the tongue for symmetry and lesions. Then we're going to come down and we're going to start with the neck. We're inspecting the neck for symmetry, tender or swollen areas. So we're actually going to be palpating the lymph nodes. You have the patient sitting upright, neck is just slightly flexed, and you're going to palpate starting at the nodes right below the earlobes, and then work your way down under the angle of the mandible to midline. Patients may have small, mobile, non-tender nodes. They call them shoddy nodes. And this is actually okay, this is normal. When we think of the lymphatic system, this is not just in the respiratory system. Your lymphatic system is throughout your whole entire body. And if you have an infection, it is your job for the lymphatic system to come in and take out the trash. So if you have issues going on or a swollen lymph node, that's usually a good indication of something's going on, something's invading your body.